My name is Ted Sugimoto. I'm a U.S. trained general surgeon, and I'm here as a surgeon and working at Bartomeu Medical Center.
We had a great tour through the hospital with Dr. Sugimoto. Heard a lot about kind of the medical care that's going on there. Even on a day when he said they weren't that busy because it was the dry season, so there's not as much malaria and stuff, there were still a good number of people sitting around, both for the dental side and the medical side.
The hospital project is a ministry that was started in 1999 as a small dispensary basically, but has evolved now into a 4-story building with many services provided to the community, not just here in Thiès, but also for villages all around Thiès.
Standing on a sand road, dirt road, there's no pavement there, and it's just a nice facility that looks to be about 2/3 complete, maybe half complete.
That is a very tough place because it's one of the better healthcare facilities in that country, and yet you are confronted with death and the reality that life here is different.
We have a lot of patients with malaria. Malaria is endemic in the area. Many people we treat as an outpatient. We give them the medications, they take it at home. But some of the complicated cases of malaria, we have to admit them to the hospital and treat them with IV therapy. I have patients coming in for hygiene-related problems like intestinal parasites, skin conditions we can treat as an outpatient. A lot of children, particularly during the rainy season, have pneumonias, ear infections. Occasionally we have problems with meningitis outbreaks and cholera outbreaks, things like that.
To get done what the doctor needed, you could see where he was always worried that he might not have the resources that he might need, you know? So I think that, if anything separated it from us, there wasn't really any difference in the fact that it was a hospital and people were there to get help, but it was the resources, where you would never think in the States that any doctor could ever run out of a resource that they need. They were always on the fringe.
People will die because of medical care and lack of medical care. Knowing the progress that they've made, leaps and bounds on the building, on the staff, it was awesome to see.
And it's a hospital that's a church-supported hospital, and they preach the gospel in the hospital. The people that come there know that the kindness that the doctors and the staff offer because of the love that's in their heart for Jesus.